And also remember, don't believe what I'm saying in this video. This video is all for entertainment purposes.
A corrupt government cannot liberate the people. If the head of the stream is corrupt, the entire river will be also.
Alright, so ladies and gentlemen, you know, so we have a bag of food right there. So may I watch Andre Stevenson, right? May I watch Andre Stevenson now come across this information here. I may have to play the clip. Nigel Clark. Christopher TUFTON in a serious trouble, you know, ladies and gentlemen. The situation of the healthcare system is way more critical than we could have ever even imagined. But a lot of PR is using and being done. You understand? And watch you know? You don't know, say, Mr. DAWES, you understand, the shadow minister for the Ministry of Health, him come out strong. So I want to hear him have to say. And more to go over to Andre Stevenson page and go watch the live stream, ladies and gentlemen, and hear the details from the doctor will come tell you what go on over the hospital there, where the young lady never get the surgery done because they don't have no AC and them something. One bag of foolishness. I may cover that already, but uno definitely need to pay attention to what is going on, because so much things is happening in Jamaica. I mean, say a lot of the stuff they might pass by on. So here we go, and bringing it to you here and highlighting it again. I'm gonna go over to Panaja TV News Jamaica. I'm gonna go subscribe, like, all them good something. So fair use. Remember to like, share, and subscribe over here so as well if you're not yet a subscriber, ladies and gentlemen. Yeah, man, it's your brother BOLO V&R. Wanna listen to this and then we'll come back to it. Then
I want you guys to hear Dr. TUFTON response. Listen to this.
For example, institutions talking with each other. There is always a reluctance for one hospital to transfer patient to the next hospital because the clinical team here feel, I don't know, inadequate if they do that. I don't know what the reasons are. In this case, it's a simple case of having a proper dialogue between in the case of the university, the sister or hospital up the road with Bustamante, which happens all the time. Whenever we have overflow during our peak season, we transfer patients up there. The under 12s, of course. We remove the fees. We have a case like this. It's for the team to sit down and say, okay, since you said this surgery might last 8 hours and the AC may not provide the full support as it is doing for those that go 2 and 3 hours, because they're doing surgery there now as we speak, why don't we engage UE and see whether or not we can make this happen?
yeah, so after that statement there from Christopher TUFTON sparked the doctor here to come on Andre Stevenson's show, and I give out the whole of the bangarang where really are going in the hospital here. So here where Dr. DAWES obviously right as a people.
Andre, let me.
Yeah, Dr. DAWES, come in and tell us.
This is probably the quietest I've been on your show, but
Doctor,
this is what is going on.
yeah,
now.
but you're listening, you're up.
Well, I am learning, you know. I know Dr. Blake from, you know, sports medicine and all of that. He's very good friends with my father, and he's one of the highly respected orthopedic surgeons in Jamaica, and one of the fathers of sports medicine.
Yeah, your dad and I started that institution together.
Yeah, man, he told me the stories. So, and he wanted me to go into sports medicine too, but I chose another road. But just listening to Dr. Blake and seeing that the problem still exists, what Jamaicans have to understand what is taking place here and contrast and compare is that the problems exist. You have 5 people, 5 families now whose children never got their surgeries done because of this. They're still left out there. I know for a fact that the surgery that was told to the nation was going to be done the next day. It could not have been done the next day because the mission was healing. I knew it could not have been done next week, which is this finishing tomorrow, Friday, right?
Yes.
This will be done anytime soon. I can tell you that because there are a lot of logistics that have to be worked out now. And what is happening, instead of trying to fix the problem or speaking with the people on the ground at Bustamante to say what happened and how can we stop this from happening again, it is all damage control. So they're meeting, you know, to see how they can out the fires, right? And even the pushback. It's what's coming out are personal attacks against me. They said that, you know, don't look at where he is pointing, look at who is pointing, and try to damage my credibility. Similarly, they're trying to damage Dr. Blake's credibility. And then now, what and I can say this because I think it has been out there. The Jamaica Medical Doctors Association, they have asked for an audit of the healthcare system among their members. They have circulated in the request that the doctors should look at what are the issues affecting each hospital across the island. So we are waiting with bated breath to see what the junior doctors audit is going to show, because it is a completely different picture from what we are being told with all of these refurbishings and the cutting of ribbons and how much money has been spent on health. So look out for that. But they know that it is coming, which is why all of these meetings now, you're going to see a lot of PR coming out now to kind of head off.
Because today, all of a sudden I hear say 2,300 and odd eye surgeries done with Cuba. And
well, that is, all right, so when I took this portfolio of Shadow Minister of Health, what I had to be studying more than anything else is PR and marketing, because that is what I am up against. One of the most vaunted PR programs, machineries in Jamaica that convinced us for 8 years that we had an improving healthcare system when it was going down and down. As
I talk about that, Dr. Dawes, I want to show Jamaica something. With all that is happening in the country and the state of healthcare. Producer, can you show the video that Minister Tufton put up this morning? I want Jamaicans to look at the tone-deaf response of the Minister of Health. Play that, producer, play it for me, please.
Ladies and gentlemen, this is CHRISTOPER speaking for TVJ News Jamaica, and we are waiting for the imminent arrival of the next Deputy Chief of the International Monetary Fund, Jamaica's Dr. Nigel Clark, the best Minister of Finance that has done an amazing job in Jamaica, so much so he's being elevated to the status of a world-class critical role to help the rest of the world. So we'll be here until he arrives, and we're waiting day and night for him to arrive so we can give him the accolades, the support, the welcome that he deserves. From TVJ News here in Washington, D.C., this is CHRISTOPER, your correspondent.
Dr. Dawes and Dr. Blake, that is what you have to be dealing with.
Oh man, that's artificial intelligence, man. This AI thing is scary.
No, it's not artificial intelligence. That was on the minister's page this morning. That was on CHRISTOPER's page this morning.
I bet you any money that what we're going to be seeing is a bunch of announcements, a lot of accomplishments, and a lot of positive stories aimed at drowning out the negative stories that are surfacing now. This is why you always see whenever there's a crisis at an institution, all of a sudden there's a lot of refurbishing, a lot of announcements about the changes to come, signing of agreements, etc. And all of these positive stories are meant to drown out the negative ones in an attempt to manipulate the masses. So they tried it. It hasn't been working of late because we have reached a tipping point now where people are beginning to wake up and the foolishness is not working anymore. With the ventilator story, a tone-deaf response, a video was circulated with a bunch of brand new ventilators saying abracadabra, with Eminem song to show that, whoa, they're saying that the ventilators are missing, but look at them appear, it's magic. Very tone-deaf video, especially when you're talking about the shortage of ventilators right after a baby has lost their lives. But that was a feel-good story to drown out everything. Then there was a massive public relations campaign that looked at how many clinics were being refurbished, the groundbreaking for the hospital expansions, and then contracts being signed, and so on. And now in this case, because the issues are one, cancelled surgery, concerns about infrastructure, you're hearing the stories about how many surgeries are done in the Cuban eye care program. Now, look also for them to try and head off this business of the doctors producing their own audits, because what they're going to do is to come out with some story that they have been having discussions with the doctors, or they have been looking at a review of the infrastructure across the island. No, they can't do that, because to do so would reveal exactly what Dr. Blake and the other doctors have been saying. So all of this is to try and just divert attention from what is going on. So it's a matter of look here, don't look over here. These are classic PR strategies, and they have been working for quite some time. But I think the consciousness of the people is becoming awakened right now, and that is why we are seeing people talking out. It's not this free walk, that free ride that they're getting on social media.
I want to ask a question now. Dr. Blake, why have you come out at this time to talk out? Is it that you're fed up? Is it that You're tired of what is happening?
No, it's really the thing that upset me the most. I'm tired of what is happening. I've been tired a long time, but I've been trying to help to fix what is happening. But when the minister can suggest that I am not speaking to my colleagues at the university hospital, and that the entire problem would have been solved if we at Buster just come off our high horses and call our colleagues at university hospital and send the patient there, everything would have been solved. That is most upsetting, because we know that when we send patients to the university hospital, they get faced with a huge bill, and in a large number of cases, the university hospital does not provide the services that we provide. You know, they get charged for registration fees, $2,500. You know, there's no registration fee at the Bustamante Hospital. They get charged for medications, and in a large number of cases, they have to come back to us to ask us to rewrite the prescriptions so that they can be filled at Bustamante Hospital. Because when they do get them at the university hospital, they have to pay. So we know that, and even though minister says they get charged surgical fees as well. Because university hospital is not a public hospital, it's not funded by the government.
On average, what is the cost for like a surgical fee of the university?
No, it varies according to the type of surgery.
For surgery.
Yeah, but I know for the scoliosis patient, one of our patients was told that it was going to cost her over $1 million. You know, this is a patient who we had sent up to the university hospital.
So my question is, Dr. Blake, with almost 10% surgery not done, that means if the mission comes next year, it will have those 10 plus who comes for 2025. Am I correct?
Yes, it will have them.
So that means that the mission would have to be longer.
Yeah, they set aside a week. We just probably have to work longer hours and try and do more cases on any given day.
But you're explaining that with what is happening with the long cases at the Bustamante.
Well, I'm hoping that by the time that one positive that will come out of all of this, that they'll feel motivated, minister will feel motivated to insist and ensure that the Bustamante Hospital gets fixed. Because he has said that money is no object. And if money is no object, spend some of that money on the hospital and fix the things that ail us at the Bustamante Hospital. Give us a first-class hospital fitting for the title of the only children's hospital in the English Caribbean. You know, just fix us. Give us a good working environment. Let my doctors feel happy.
I'm very concerned about what I'm hearing tonight, Jamaica. I'm very concerned about where we go as a country. I'm very concerned that tomorrow morning, Dr. Blake possibly will be getting a memorandum from the Ministry of Health saying that he has breached the Official Secrets Act. But Dr. Dawes, when you become Minister of Health, you will have situations, probably not as bad as this, but how do you plan to fix this with communicating with your doctors?
Well, you know, I don't claim to have all the answers. And many times when I speak, it is because I've had consultations with senior colleagues, persons who have left the system, persons who are in the system now, but they have a wealth of experience underground, not just someone who is trying to learn how medicine works, or an administrator who has just been thrust into a role because of and with that, the consultative approach has to be taken when these decisions are being made. So it can't be a policy decision where we are going to decide as a cabinet that we are going to build a new wing in a hospital and it's going to cost $5 billion, or we are going to ignore the recommendations of experts with respect to how we're going to treat with a hospital that has serious infrastructural problems, the way Cornwall was dealt with, where they ignored the experts and then made mistake after mistake, and they just put us in this bind right now. So we have to, the doctors, and I've already articulated this publicly, the doctors, the nurses, the administrators, the ancillary staff, the janitors, the security operatives, the clerical staff, the administration, everyone. We have to have a retreat at every hospital, because the problems that plague one hospital can be systemic and they can be unique as well. And with that, no, we have to have a consensus as to how we're going to move forward. There are certain systemic ills that immediately. For one, maintenance. We have to have a trained biomedical engineers. And we have to start looking to our allies for help. Cuba has trained a lot of and so on. Why can't Cuba train biomedical engineers to fix the equipment that we have broken? That's a start right there. So we look at how we can supplement immediately, because a lot of stuff we fixed and repaired with long-term training and capacity building for the persons working in it. So we have to start specifications. You can't just go to China. China has different grades of equipment. You can have equipment that look the same. They're in the same case. But one is good quality, one is medium quality, and one is poor quality. And you buy the poor quality one, come to Jamaica, mark it up a couple 100%, and then you have no maintenance package. You have no support when something goes down. And then you sell it to the ministry, it breaks down, the doctors don't have anything to use, the patients have their surgeries cancelled or they can't get their investigation, and it becomes junk. And then you repeat the cycle, where the parties are benefited far too often.
Yes.
So, fix immediately. We have to have certain standards. And even when something goes to procurement, where they're trying to look at the cheapest, a lot of technical expertise is not there. You have to have a technical review committee to say, buy this, don't buy this, this is value for money. And that is weighted. It can't be a situation where, for example, you will have a surgeon request a particular type of equipment, and what comes is far different from what they wanted, and hear how much was paid for it, for the garbage. You shake your head and wonder, why is it that how much money is being spent on health, and you don't see where it is going? So procurement, we have to look at maintenance, and then we have to look at overall now, how can we remedy the situations as quick as possible? And I heard a pushback was a personal attack on me to say that, how can I be talking conscience, and remember that it is the people that you're dealing with at the forefront of your business. You cannot capitalize on this desperate situation to gouge the system through emergency procurement and single bidder processes to siphon off money for you and your friends because you see a dire emergency taking place. So public-private partnerships have to be an integral part of how we fix the system, because the capacity of the Ministry of Health to buy everything at once that is needed, it is going to outstrip all of the other budgets for education. And Damian Cross has already, stated with full backing that we have to prioritize education. Dayton is looking at agriculture. For far too long, the farmers have been the victims of handouts of seeds and water tanks, while the big import license that stop them from being competitive locally are going to friends of the ruling government. So there are things to be fixed, and I can't claim to want all of the capital budget or the discretionary budget for the next administration. So we have to look at what is the most efficient way of getting this thing done. And a fair, well-managed, well-thought-out system where you have public-private partnerships, where every patient can feel like, every public patient like they're a private patient. And also we're going to have national insurance. But in the meantime, to get the theaters up and running, to get the A&Es less crowded, to get proper diagnostics and so on, we'll have to have a proper framework in place for public-private partnerships while we build the capacity of the...
Now, ladies and gentlemen, a lot was said there and a lot to digest, and trust me, there's a lot more for you to go and listen to from Andre Stevens' program. And that's what I'm saying. I encourage you to go over there to, make sure you like, share, and subscribe. Now, my thoughts is this. Apparently, according to the doctor and Mr. Vaz, there's a lot more that is to be revealed with the healthcare system. That situation with that young lady that was highlighted the other day is just a microcosm of a larger problem in that ministry. Equipments need to be properly maintained, and a lot of different things. Although they're getting help from overseas, thousands of US dollars apparently. And also people aiding and giving their time, those professionals coming down, which they have been doing for 20 plus years, as I heard on the program. With all of those help and all of those things, ladies and gentlemen, I can believe that we are in the problem and the conundrum that we're in the healthcare sector. This young lady, and one of the lies that Christopher TUFTON told that is unforgivable, that Mr. DAWES came out and said that the young lady could get the surgery done tomorrow. As a professional, is either he didn't know, right, or he misinformed, or him incompetent and him is not the right man for the job. But whatever the case might be, according to the professional, not my word. According to the doctor, that's not my word. That surgery could not have been done the next day for many different reasons. And he mentioned logistics. You understand? But ladies and gentlemen, trust me, I could go on and on and on and on and on. You understand? But me want to know what you think in the comment section. And also, remember again, go over to Andrea and go watch the full video and go hear all of the things that the doctor reveal that is actually going on in that particular hospital, and also hinting to other things, and even mentioned Shaggy, the situation with Shaggy. So we'll never see Shaggy Foundation give another donation. That situation was handled terribly. Alright, so the PR campaign is being exposed. It's all about sounding good and looking good on the television, but the reality on the ground in these ministries of government is horrific. Alright, straight mismanagement and just terrible. Right? What else is going to be revealed in 2024? We have a couple months left, literally. It's going to be very, very interesting. All lies will be exposed, and there's nothing them can do about it. Right now, I know them are shaking at them boots. So don't tell me all the thing in the comment section. Remember to like, share, and subscribe, people. It's about BOLO V&R 2.0, and I'm OUT. Thank you for watching.